Good evening, guys. I've got one more bonus one for you, and it is discussion F. Okay, we're going to discuss what to know as you research nursing home care for a loved one, for your loved one. Okay, so here we go. Um, Please join me in tonight's bonus F discussion. Okay, here is a summary of the key takeaways from the article. What to know as you research nursing home care for your loved one. Okay. Assess individual needs first, guys. Before starting your search for a nursing home, thoroughly evaluate your loved one's physical health, cognitive status, and medical requirements. This foundational step helps you identify facilities that can provide the right level of care for your loved one, folks. Prioritize safety and comfort. When visiting or researching facilities, look for indicators of quality care, such as staff uh, qualifications, cleanliness, resident engagement, and compliance with state regulations. Second thing, guys, do your research thoroughly. Make sure that they can meet your loved one's needs. Check for abusive. Check for staff abusing residents and such, and reports on that. That matters also. Okay, take time to compare multiple options. Use resources like Medicare's nursing home compare, check inspection reports, and read reviews to help guide your decision. Third thing, plan ahead if possible. Begin the planning process before a crisis arises. Early research allows for more thoughtful decision making and greater involvement from your loved one. If you're refraining, if you're refining a checklist or decision matrix for facility selection, I'd be glad to help uh, structure that further. Want to take it in that direction. If you can, translate these uh, board principles into actionable steps like this. 1. Clarify care needs. Create a checklist based on your loved one's medical conditions, cognitive abilities, mobility, and daily support needed or needs. This will help you filter out facilities that can't meet these criteria. 3. Set priorities based on values. Consider what matters most to your loved one, whether it's social engagement, cultural alignment, staff consistency, or a calm environment. These personal values can guide your observations during site visits. 4. Evaluate facility quality. Use tools like Medicare's Care Compare to look at inspection results, staff ratios, and quality matrix. During visits, take note on how residents interact with staff and look for signs of engagement and respect. Six, include your loved ones when possible. If they're able, involve them in tours or decision making. This respects their autonomy and can ease the transition. 6, anticipate further needs. Choose a facility that can adapt if your loved one's condition evolves, like moving from assisted living to skilled nursing without needing a transfer. Okay. If you'd like, I can help you build a tailored decision matrix or even draft questions to ask during site visit. Would that be helpful? To evaluate nursing home facilities with confidence and precision, you can use a multi-dimensional set of criteria that blends practical, clinical, and emotional needs. Considerations. Here's a structured list to guide your assessment. Okay. One, clinical capabilities and staffing, licensing and certifications. Is the facility state licensed and Medicaid, Medicare approved or certified? Staffing levels. Look at nurse to resident ratios across shifts. Higher ratios often correlate with better care. Specialized care. Can the facility manage conditions like dementia, Parkinson's, or post-stroke rehabilitation? Staff training. Are caregivers trained in person-centered and culturally responsive care? Okay, 2, environment and safety, cleanliness and maintenance. Observe general hygiene, odors, and upkeep. Okay, infection control. What protocols are in place, especially post COVID? Okay, accessibility. Are rooms and common areas wheelchair friendly and fall resistant? 3, resident experience, resident engagement. Do residents appear involved, emotionally supported, and socially active? Those things matter, folks, when you look for a place for a loved one. Choice and autonomy. Can residents uh, personalize routines, meals, and daily activities? Cultural fit. Does the facility accommodate religious, cultural, or dietary preferences? 4, staff to staff resident relationships. Observational clues. Watch how staff interact with residents. Are they patient, respectful, and responsive? Consistency. Does the same staff care for the same residents regularly? Then you've got quality matrix. Inspection reports. Look at deficiencies, cautions, and improvement plans from the last 3 years. Hospital readmission rates. High rates can signal care quality issues. Falls, pressure ulcers, and infections. Track record of preventable conditions. Financial and legal. Contracts and costs. Review transparency on fees, refunds, policies, and services included. Medicaid eligibility. Will they accept your loved one's private funds? Will they accept your loved one if private funds run out? That's a question you have to consider also, folks, is if your loved one will have coverage or money when their 30 days is up, and what specific things they have to pay for, what the facility provides, and what they have to pay for also. Bonus for holistic care elevator evaluators like you. Cognitive and emotional support services are therapies like reminiscent programs, hearing and support, or grief counseling, part of the care plan. Caregiver support. Does the facility offer resources or respite for families? Would it be helpful if I helped you turn this into a weighted decision matrix to score and compare facilities systematically, or draft questions for a visit, for a site visit, or care plan meeting. Residents non 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 indicator of cognitive stimulation or emotional well-being and quality of life. Okay, guys, so that is it for tonight. See everybody tomorrow. For now, Gator Wellness. Take care, folks.